Hello, everyone. My name is Kimberly Jones. This is my third and final current issues course, sadly. Previously, I presented on the effects of lead exposure on bald eagles and the impact of oil pipelines on biological systems. I decided to change things up a bit this semester and present on the artificial kidney. This topic was actually sparked by a conversation between my husband and I. We were discussing ideas about how to save up for a mortgage down payment whenever I jokingly said, how about I just sell one of my kidneys? Being a jokester, my husband said, why not just sell both? So this left me with a lot of questions in my mind. So I started Googling if someone can survive without kidneys. And basically, I started wondering, can artificial kidney be a solution for people who have decreased kidney function or are going through renal failure? Just so that you know what we're going to be going over here today, I wanted to provide you here a table of contents. We're going to begin by going over some general information about the kidney and kidney disease. Next, I'll cover some basic statistics and basically the importance of why we want to study this subject here today. Then I'm going to go over the pitfalls of kidney transplants and how artificial kidneys can be an advantage to comparing these two potential treatments for kidney patients. After that, I'm going to cover a study that encompasses a wearable artificial kidney. And then I'm going to conclude and then allow for any questions that you may have. Knee that sits in your upper abdomen against your back muscles, which you can see in this picture. So basically, if you make a fist right now with me and put it behind your back as if you're going to be arrested, that's about the general location of your kidneys. A fun fact about the kidney is your left one actually sits a little bit more superior than the right kidney due to the liver being on the right side of your body. Next, I wanted to go over the anatomy of the kidney on a more macroscopic level here to begin with. We'll discuss some of the microscopic anatomy features on the next slide. The kidney contains a fat layer on the outside, which is not depicted in this figure here. But if you could just imagine a fat layer on the outside here for a moment. It does have a renal capsule, which is this very thin, tough, fibrous outer layer here. You can visually see the kidney is made up of different sections. The outer section is called the renal cortex, which contains nephrons, which we'll discuss a little bit more on the next slide, since this is, a functional unit of the kidney. The inner section is called the medulla, which is made up of 8 to 12 medulla pyramids. You can see my pointer. These are the pyramids. These are formed by a network of collecting ducts. The calyces are these little extensions that act as channels to move urine from the pyramids to these basin-like area here called the renal pelvis. The renal pelvis leads to the ureter right here. Sorry, my pointer keeps disappearing. But basically right at this concave area is called the hilum, along with the renal artery that supports the vascular structure here. So it's this area right here is the hilum. So here's more of the microscopic features of the kidney. The nephron here that I mentioned earlier is the functional unit of the kidney. The kidney is made up of about 1 million of these little tiny filtering units that filter a small amount of blood. The filtering component of the nephron is called the glomerulus, and there's another component here called the tubule. The nephron works through a two-step process where the glomerulus allows fluids and any waste products to flow through it while preventing blood cells and large molecules from flowing through it. Once the blood has been filtered through, as well as filtered from the other material, it actually passes through the tubule, then sends the necessary components back to the bloodstream, and then it removes any waste, which eventually becomes urine. The kidney plays roles in hemodynamics, metabolism, immunology, and endocrinology of the body. Some of the main functions of the kidney overlap in various categories. In addition to preventing the excess waste and fluid buildup, the kidney helps to keep the level of electrolytes stabilized and helps to regulate blood pressure. The kidney makes hormones for the production of red blood cells and keeps the bones strong. The list of important functions of the kidney and its contributions to the overall stabilization of the body can actually go on and on, but for this purpose, I just need you to remember we cannot function without our kidneys. Associated terminology, acute kidney injury, or AKI, is when there's a sudden or temporary loss of kidney function. Next here, this chronic kidney disease is when there's a reduced function of the kidney over a period of time. The level of reduced function marks the 5 stages. With the stage 1 being kidney damage while maintaining normal function, and the stage 5 being that kidney failure and requiring dialysis or kidney transplant. The end-stage renal disease, or ESRD, is a total and permanent kidney failure. Dialysis is a simple treatment to filter the waste and excess materials from blood in place of the functions that your kidney normally does. The glomerular filtration rate, or GFR, is the rate that the kidneys filter these waste and excess material from blood. It's measured in milliliters per minute. This is also the unit measure to evaluate what stage of CKD a patient is experiencing. Kidney problems is observed to be a worldwide issue. A total of 1.5 million individuals are receiving hemodialysis treatment, which is a large number if you think about just general population numbers. Kidney problems is observed to be a worldwide issue. A total of 1.5 million individuals worldwide are receiving hemodialysis treatment, which is received at stage 5 of CKD. So this does not incorporate every individual with a related kidney issue. So I'm sure that number is much greater than 1.5 million. But particularly focusing on North America, 661,000 individuals suffer from kidney failure. 648 are on dialysis treatment. Kidney failure has led to approximately 100,000 patients needing a kidney transplant, which is a large number. Of these needing a kidney replacement, mortality ranges from about 5 to 10%. More people eventually die from kidney disease compared to breast and prostate cancer. So that's a great statistic right there, comparing it to cancer. With so many people being affected and dying from kidney issues, something needs to be done. Well, unfortunately, it's not that simple. The demand for kidney transplants actually far exceed the need for them. Of the over 100,000 that I mentioned on the previous slide that are waiting for a kidney transplant, only about 17,000 of those transplants actually take place per year. The average wait time for a kidney transplant is about 3.6 years, which, depending on the severity of the kidney disease, the patient may die before this even happens, or they may become too sick to even receive a kidney transplant. Of the people that receive a kidney transplant, about 40% die or lose kidney function within the first 10 years of the transplant. Sometimes the transplant kidney can have a delayed function, which is very dangerous because that means it's not working for a period of time, which it's not doing what it needs to be doing to prevent, further damage by the kidney not working. Moving away from the kidney itself, patients have had a successful kidney transplant have been observed to have a declined psychosocial well-being compared to normal individuals. This overall impacts the patient's interpersonal relationship, which plays a big role in their quality of life. The disadvantages of kidney transplants and dialysis treatments. Wearable artificial kidney devices have been developed. With the wearable artificial kidney devices, patients no longer have to follow the strict dietary and fluid restrictions such as low sodium or high protein intake diets, along with the limited fluid intake that they would have to do during dialysis treatment. There's also no need for the high medication burden. So this means less side effects, or actually no side effects from the high doses of the medications that they must take. Time spent traveling for dialysis treatments or kidney transplant follow-ups or any kind of doctor appointment related to it is completely eliminated with this wearable kidney device because it can be monitored from, an external location. And return patients will not experience dialysis sickness treatment if they're not receiving it. So, and basically this dialysis sickness syndrome is a common effect after dialysis treatment. Overall, the wearable kidney device adds to the patient's quality of life, and they can go about their lives as if nothing was wrong. It's much like wearing an oversized pedometer, as you can see in this image, compared to a huge dialysis machine that they would have to be hooked up if they went to receive the treatment, depending on their severity, several times a week. So we're looking here at a study by Victor Guerrara and his team of scientists, actually back in 2016, so it's very recent. So basically he wanted to determine the efficiency of the wearable artificial kidney during a 24-hour period, and he used end-stage renal disease patients, which is one of the worst stages you can be, because that means you need severe action. Basically, to sum up the study, they wanted to overcome the limitations of the different treatments that I mentioned earlier, like transplants and dialysis. So basically, advanced technology is the perfect opportunity to make patients' lives simpler. Looking at this, the end-stage renal disease patients, you can see that there's 7 subjects that were actually finished the study trial. This breaks down their characteristics. You can just review it yourself here, but what we're really going to focus on in the study is their blood levels, which I'll review here in the results. So the methods for this was the patients wore this wearable artificial kidney for a 24-hour period, and there was different variables that was measured by the artificial kidney over this period of time, which is solute clearance, electrolytes, volume homeostasis, as well as device performance and technical complications was also reviewed during this period of time, adverse events and tolerability. And also the patients were giving a questionnaire at the end of the trial to basically rate their satisfaction and quality of life by wearing this related to their conventional treatment, which could be a transplant or dialysis, which is more common. So looking at the results here, the solute clearance level on the y-axis, you can see a variable here of interest, measured in milliliters per minute, and then we have flow on this side, and then time across the x here. And the different solid lines actually represent the solutes of interest, which was urea, phosphorus, creatine, and the beta-2 microglobulins. And you can see blood flow and diastolate flow in the dotted or dashed lines right here. What's really important to note here is your beta-2 microglobulins is significantly lower here, but they all generally follow the same pattern. Reviewing the electrolyte and volume homeostasis, you can see the electrolytes generally stayed stable throughout the trial here. It's particularly notable here, I guess, that we went from 140 here for the systolic blood pressure to 127. However, that was not statistically significant. So there's nothing extremely notable to take away from the electrolyte or volume homeostasis. Moving on, they wanted to compare the conventional dialysis versus the wearable artificial kidney, and the first little variable they wanted to compare was your blood urea nitrogen bun levels. So basically you could see that it was much lower during the wearable artificial kidney treatment. But then as soon as that ended, it rose. But you can see that whenever a person receives dialysis here, I mean, it's kind of a 1-point scenario because it's not a continuous treatment like the wearable artificial kidney, so it just spikes. You can see that the beta-2 microglobulin here basically follows the same pattern as the bun levels on the previous slide, where we have a clustered event here and then a rise afterwards. And then the same thing for this. We have the 1 point of treatment and then a rise afterwards. Moving on to the device performance and technical complications, there was one episode of clotting in which the subject was not able to continue due to the precautions. Two of the patients need battery replacement, which is a very minor thing. I mean, everything has to have battery replacements, but that also serves as a potential study point where they could determine how long it takes for a battery to run out, so that they can find the optimal time to basically insert a new battery so that you're not losing any function. Next, there was 3 patients that had to have removal of gas bubbles, which was easily done with a syringe, and that was actually narrowed down to priming the machine at the beginning of the trial. There's no serious adverse events or tolerability issues, only minor side effects such as nausea that the patients has actually reported. The patients were very satisfied with the overall treatment, as well as their quality of life wearing the monitor. Even though this was only for a 24-hour period, it's important that the patients are comfortable and satisfied with the treatment. So concluding here, an alternative kidney treatment was not efficient, such as the dialysis that we went over and briefly talked about, as well as a kidney transplant that we had went into much detail about. So we basically needed some kind of technological advance to make things more efficient. And this wearable artificial kidney really fits this gap, that it basically makes the patient's life more satisfactory, and they can have a good quality of life. And it's also wearable so that the patient can have a continuous function of treatment, compared to like dialysis that is just, one period of time where you go for visits. So looking over the minor issues, such as, batteries and stuff like that, this needs to be worked out, but that's minor at this point. And we could see that there is great potential with these wearable artificial kidneys. But we do need to improve things, because this was only a 24-hour period, and we definitely need to know the long-term effects if this is going to work over an extended period of time. But also the advancement for making things smaller. You know how we're always trying to make things smaller. We went from, a large cell phone to little tiny things that you can buy today. So basically people were theoretically coming up with these implantable kidneys, artificial kidneys. There are some people coming up with different trials to try these out. However, there's so many kinks in the theoretical area, because they're trying to use cells that mimic kidney function and such. So we really need to focus on this area and keep improving, even if it's the wearable artificial kidney, just getting it on the market and making it more easier for patients to obtain. So that basically concludes my presentation, and I'll take any questions that